Good afternoon, everyone, and thank you for joining us today for the first event of this year's Race and in America series. My name is Richard Locke. I'm a professor of political science and international and public affairs, and I currently serve as Provost. For the second year running, I am really honored to co-sponsor this remarkable series. When Professor Tricia Rose first came to me with this idea, I knew instantly that this was something that we needed to do, and I was far from alone. Just last year, when we inaugurated this series, more than 3,000 people joined the 8 different events that we hosted. And I have no doubt that this year's programs will be equally successful. And the reason is clear. There is no more pressing issue right now than addressing systemic racism in the United States. I said this in my remarks last year, and I think it remains every bit as true today. And it's also true now more than ever that higher education institutions are essential to making this change. Through our research and teaching, we can and we must be agents of advancing knowledge and promoting social justice. This is a time of unique challenges and unique opportunities for those of us at colleges and universities. What we do matters. It's incumbent on us to seize the moment and work for positive social change. And for all these reasons, I am so grateful to Professor Rose and her CSREA colleagues for their work in curating the series, and to the exceptional scholars who have so generously agreed to share their expertise in areas ranging from race in poetry, race in the environment, race in music, race in performance, and today's talk, race and inequality. And it's through this series of 5 panel discussions, 5 events, that we hope to continue to promote the kind of meaningful conversation and discussion around race, racism that has been so important both on campus and beyond. And it's fitting that this year's panel and series begins with a panel discussion on race and inequality, which is a topic that is ever more timely and urgent. We see this in the vast disparities of wealth and income, in educational inequities, in health disparities, and in the unjust and disproportionate use of police force, and in so many other inequalities, both magnified and accelerated by the pandemic. Such injustices stand as steady reminders of just how much work remains to be done to create a truly inclusive, healthy, and just society here in our country, but beyond our country as well. And at the same time, demands for justice are growing and becoming more insistent. I see this every day at Brown. It is so inspiring to see the energy among our students and faculty and staff, and believe it or not, even senior administrators, all deeply committed to eradicating structural racism. And it's so inspiring to be part of events like this that educate and bring us together. With race and inequality, we explore a crucial topic, one that both informs and shapes countless others. And I want to shout out and give a thanks to our panelists, professor and wonderful colleagues, Professor Jose Itzigsohn, Professor Prudence Carter, and Professor Jennifer Nazareno. And now let me turn it over to Professor Tricia Rose, who will be moderating this session. And I hope that everyone who's registered today will continue to participate in future events. So thank you and welcome, and thanks, Tricia, for your wonderful partnership.
Thank you very much, Rick. I really appreciate all you do at Brown and how many collaborations we've been able to foster on these subjects and many others. So CSREA is in large measure where it is today because of your support. I too was very impressed with the turnout and the interest and the engagement and the continued conversations that we started with this series last year. And so I'm delighted to continue it this year. There are a few things we're trying to expand, and I'll mention it briefly before introducing our amazing trio of colleagues and scholars today. One is that, we really wanted to think about 2 kinds of expansion of the vision of the project. One was into the arts more generally, Because, you know, when you think of questions of race and what we think often very systemically, but it's also really important to think about the creative responses and the creative traditions that are part of transforming the concerns we have. And the other direction that we're moving into is to think comparatively across racial and ethnic groups. So you'll see today that we're doing the latter, and that several sessions coming up will be doing a little bit more of the former in terms of the arts. So today's plan is to have our three fantastic speakers and colleagues share a piece of their work. It's a small piece of their work. All three of them have a pretty extraordinary level of research profile. And they will move one in after the other, 10 to 15 minutes each. And then I will field questions I'll probably have my own list, and then I'll field questions from the audience, and we'll immediately get into conversation. So let me just give a very brief bio. There's plenty more biographical information in the chat. In the chat, there's information about where to find that. And throughout the talks, feel free to post questions in the Q&A section, and we will make sure that we keep them and make sure they're available at the end. And the speakers will speak in this order. First we start with my dear colleague, Jose Itzigsohn, who is professor of sociology at Brown and is a Du Boisian sociologist, aims to rethink the discipline along the lines proposed by Du Bois, which is rooted in a historical understanding of the present and taking racialized modernity as the object of its work. Professor Prudence Carter, who, for those of you who may not recognize her name as a Brown faculty, is a brand new member of our faculty. We're really delighted that she's here. And she is the Sarah and Joseph Jr. Dowling Professor of Sociology here at Brown. And her primary research focuses on the explanations of enduring inequalities in education and society and their potential solutions. Specifically, she examines academic and mobility disparities shaped by the effects of race, ethnicity, class, and gender in the US and global society comparatively. And last but not least is a dear colleague, Jennifer Nazareno, who's also a CSREA fellow this year, and she's an assistant professor with a dual appointment in the Department of Behavioral and Social Sciences in the School of Public Health and the Nelson Center for Entrepreneurship. Professor Nazareno's areas of specialty include medical sociology, structural determinants of health, women's migration, labor, and entrepreneurship. So please join me in welcoming Professor Jose Itzigsohn, who will begin our session now. Thank you very much.
Thank you, Tricia, and thank you for inviting me to this event. It is a pleasure to be here with you, sharing some ideas about questions of racial inequality that are certainly one of the most important issues in our times. So with your permission, I will share my screen and present some slides about my work and some ideas about contemporary racial inequality. So my talk today is titled "The Racialized Class System, Racial Capitalism, and the Intersections of Class and Race." And that's what I generally work on, the intersections of class and race and how they constitute a racialized class system. And I've done this work first in my book on the Dominican community in Providence, entitled Encountering American Fault Lines. Later on, I published a paper together with my colleague and former student and current colleague, Marcelo Bort, who is a professor at American University. And we published a paper together on Latinx people in the American class structure. And we continued this work by doing some analysis on Asian Americans in the contemporary American class structure. That it's a paper that we just sent for review, and we wrote together also with a Brown undergraduate, Michelle Liu, who is a senior in sociology. So this is an ongoing work that we hope to extend into the future and historically, as looking at these intersections historically. So in order to analyze the the intersections of class and race. We built an occupation-based model of the American class structure that we use to compare the class distribution within different ethno-racial groups. And we chose to do an occupation-based model rather than a socioeconomic index model of class, because that allows us to look at class and race intersections in relation to the changing structure of the American economy, and also to look at it in relation to different patterns of politics and collective action, something that we hope to do in the future. The results that we obtain, in a way, are not surprising, but are important to document. And what our research shows is that, on the one hand, whites and Asian Americans have a larger proportion of people in the upper and the middle classes than Latinx people and African Americans, that in turn have larger proportion of people in the different sectors of the working class. Our model allows us to distinguish between the service working class and the manufacturing working class. We see also that there is a wide diversity in the class distribution of different Asian American groups. That is, there is not one Asian American story, but many different Asian American stories. And the same is true for Latinx groups. We see that the 1% is predominantly white. In the class model we built, the upper class is interesting. It's not something that we did in purpose. It just came out that the upper class is really the 1% of the population and is predominantly white. And we think that understanding the racialization of the class system in this way is important for understanding the diversity of race and class experiences. I mean, the experiences and trajectories of people don't depend only on class or only on race, but on the specific intersections of class and race, and also gender. And it's important for analyzing contemporary politics, because if we look at collective action, voting, party belonging, we see a very clear relationship with the intersections of class and race. Now, a note on methodology. We use quantitative methods, that is the building of variables that we measure quantitatively, and we use regressions. But we try in our work to link quantitative methods to history and social structure, that we think is an issue that quantitative scholars need to do more. Because quantitative variables, in particular variables that talk about racial identification, do not refer to individual characteristics, but to social relations involving power. So it's important to understand what those relations are and what forms of power are involved. And we also need a theory of the historical social structure in order to make sense of quantitative results and the historical changes of race and class. And if we look at that theory of the historical system, we take the theory of racial capitalism, or understanding modernity and capitalism as racial and colonial capitalism. In doing so, we go against some forms of the dominant forms of mainstream thinking in sociology that developed from the work of Robert Park and the Chicago School in the late 1910s and early 1920s, and that have structured sociological thinking since, in particularly the different forms and the varieties of assimilation theory. I mean, we work on the trajectories of immigrant groups, and the trajectories of immigrant groups are often analyzed in terms of assimilation, how much they resemble or don't resemble some kind of ideal American mainstream. And we think we go against this kind of thinking, understanding capitalism and modernity as racial and colonial, because it's not just the United States, it's a global system historically tied to colonialism. And understanding American society not as a society that leads to the blurring of difference, but is a society that is characterized by very bright boundaries of class and race that have a persistence in history. And we take this idea of, the idea of racial capitalism has several sources. On the one hand, scholars in South Africa analyzing the apartheid system. On the other hand, the work of Cedric Robinson on Black Marxism. But we draw from the work of W.E.B. Du Bois, who particularly in his later works argued that historical capitalism is structured around the color line colonialism and coloniality, and he does it in really a very profound way. So there is complexity in the system. The forms of inequality, of class and race inequality change, they constantly change, but racial inequality has ways of reconstituting itself in different forms, and the research program is to understand how they reconstitute how racial inequality reconstitutes itself in different times and places, and what particular forms of racial and class intersections are in different times and places. In terms of the contemporary reproduction of inequality, there are many mechanisms that have been documented widely in the sociological literature, and I want to point to some. It's not exhaustive. On the one hand, there is an educational system that works differently along racial lines, and for that, I want to point to the work of my colleague, Prudence Carter, that is going to talk after me, and also to the work of my soon-to-be colleague, John Diamond, that is going to join the Department of Sociology here at Brown in January, and the book that he wrote with Amanda Lewis, Despite the Best Intentions. Another mechanism of reproduction of racial inequality and race and class inequality is the justice system that constantly produces unequal justice. And for that, I want to point also to the work of a colleague of mine in the Department of Sociology, Nicole Gonzalez Van Cleve, and to her work, Crook County. Another mechanism of reproduction of class and race inequality is the racialization of the labor market and of patterns of hiring and promoting within the labor market. And for that, I want to point to the work of Dee Royster, Jennifer Chang, the late Deva Pager, and to the work of one of my current students, Prab Kehal, who is doing great work on showing how this works in the academy. And also, there are mechanisms of spatial inequalities that there is a large literature in sociology. Also, a lot of it is done here at Brown at the S4 Institute by colleagues in the Department of Sociology that show that different groups have access to different spaces, and that the access to different spaces has consequences for their life conditions and their life trajectories. What a theory of racial capitalism allows us to do is to take all those different threads and all those different mechanisms of reproduction of class and racial inequality, and weave them together into an analysis, a holistic analysis of the historical moment and how these different systems work together and how they change throughout history throughout history. And that's the advantage of looking at it from the perspective of racial capitalism. It allows us to bring these different mechanisms and systems of production of racial inequality together. And again, looking at the class and the intersections of class and race is very important to look at individual trajectories, individual experience, at the politics of the country, at the political position, voting, collective actions of people. And that's the research program that Marcelo Bort and I are engaging in currently. So thank you very much for inviting me. Thank you very much for being here and listening to these ideas. And I leave now the floor to my colleague, Prudence Carter.
Thank you very much. Thank you, to you, Jose, my dear colleague, and thank you to CSREA and its director, Tricia Rose. It's a pleasure to actually have my first kind of formal speaking engagement here at Brown. I am an alumna. And also, not many people know that I also began my professional career here. The reason I am a sociologist of education who focuses on the intersections of race, class, and gender and inequality is because of the work that I did as an admission officer right after I graduated from Brown, traveling on behalf of this university to central cities like Detroit and Cleveland and Newark, looking for academic gems on behalf of Brown in public high schools in the central cities, as well as the well-known private and independent schools throughout these regions. And so I want to start by saying that education is one of the most impactful social institutions. And as my colleague, Jose Itzigsohn has just said, in our lives, it is one of the most impactful when you think about the amount of time exposed, embedded in our educational system. And that system, that institution of education, the social institution, is heavily racialized and classed in American society. And we reproduce the racial class system through the media of K-12 education and even higher education. I'm going to start my screen right now by sharing with you some data that others and myself have gathered over time. And it's important for us to get a picture of the national portrait, as well as to understand how our own local contexts fall within that. So one of the things that I want to start off by showing you is some data from one, perhaps the largest American educational research database today. And this is one put together by Sean Reardon and his colleagues at Stanford University, my former place of employment. And Sean and his team put together over 40 million cases of test scores that were amassed across every school district in the United States. And these data show the correlation between the composite socioeconomic status of those districts and the average achievement on these various tests, standardized across all 50 states. They show you the 100 largest US school districts from 2009 to 2016. And what you can see, for those of you who can see this, it's standardized from to the right of zero to the most affluent communities, and to the left of the zero to the most poor or economically disadvantaged communities. And one of the most startling findings from this data set, when you look at this horizontal broken down line, which is the national average of test scores, is the case that there is not one predominantly poor and or economically disadvantaged communities whose average test scores fall above the national average. The districts whose average test scores fall above the national average are wholly affluent districts in this country. The correlation is startling. And we know in this country that there is an inextricable link between race and ethnicity and socioeconomic background. And so it is not a coincidence that the large Black and brown cities in our country, like Detroit and Cleveland, Los Angeles, that you will find that the mean test scores in those districts would fall below the national average. And it is not because those students don't have the academic potential, I'm going to suggest to you. I'm going to suggest to you, based on the work that many of us have done, it is because we have not been paying attention to the inputs of the systems. We live in a society where achievement gaps are driven by opportunity gaps. if we were to believe that those students in those districts that are highly predominantly Black and brown don't have the academic potential, then we would have to fall back on really problematic neo-eugenicist and genetic arguments. There is something wrong. There is something that is not actually fully fleshed out in the ecology of children's lives. And that's one of the main arguments I'm going to make. Now, couple that with what we've all been through in the last 2 years, where a global pandemic has afflicted most of our communities. And we know from McKinsey and Company, who've put out data just recently, that many students have actually suffered academically because of the pandemic. Many did not have access to, during the pandemic, to the technology, to online resources. And if they did, oftentimes they may not have had someone in the household who could support them in that work. And so now we see that the academic disparities may have actually been compounded by this pandemic, where students who attended schools greater than 50% of color or with the Black dots are finding themselves attaining, in terms of average reading and math scores, just a slightly lower percentage than what we would predict on average for them at this point in time. And those who are attending schools with mostly white students are in the higher brackets, there has been some loss for all students, but the disparities in loss are still quite racialized, and that correlates also with class. So we argue in our work, in one of the books that I put together, co-edited with my colleague Kevin Wellner, along with economists, historians, political scientists, and other sociologists and educational researchers, is that achievement gaps as we know them, they emphasize grades and test scoring rates and test scores and college going and completion rates, but they don't really tell us about why. And the achievement gap, we argue, focuses on the conditions, the causes, the cancers in societies that lend themselves to the problems that we see as afflicting American educational public systems in this country primarily. And one of the arguments we make is because we're not actually reckoning with, in our social policies and practices, the fact that some kids metaphorically are born into conditions where they're on speedy elevators. Others are on smoothly riding escalators, and others are on stairwells with missing steps and missing handrails. And we're asking them all on average to get to floor 13 at the same time. But the ecological contexts are radically different. American educational inequalities in this society are highly racialized, and they're highly classed, and they're highly attributable to the disparities. And if we use a deficit analysis, it's the deficit in the actual material context of communities across the country. And so we see them play out in the symptoms, which are the test scores that many of us then fallaciously tend to use as the indicators of talent and intelligence and achievement. I argue in my own work that there is a significant difference between the material context and the sociocultural context of schooling, but they both have to come together if we want to fully explicate, explain, and even eventually eradicate achievement disparities that are race and classed in America. I did this work comparatively across two highly racialized societies, the US and South Africa. And while we already know that the economic resources really matter a lot, I want to take your attention also more inwardly to some of also the major socio-political and social cultural mindsets and attitudes that impede the reduction of race and class inequality in the United States. There are 4 points I want to make quickly. First, the idea that education is a private good is a dominant narrative and practice in our society. It is, although originally the massification of education came about with the idea that it would contribute to the development of the republic, that it would actually lead to overall economic productivity, including self-sufficient of individuals. It was about society. even though it was highly problematic how it was established and it was structured. But as the narrative of social mobility and the calculus for how we do that has developed, many social scientists, including David Lavery, who's a sociologist, retired now from Stanford, have argued that the competition that's engendered in the social mobility narrative has led us to fall back on education as a private good, which means that we are looking in opportunity hoarding. And John Diamond and Amanda Lewis have seen this, have argued this in their work, and Jose actually referred to that we're opportunity hoarding to get the best for our own kids. And in the process, we're colluding in educational inequality to a great degree because we don't really care so much about what happens to other people's kids. And part of that opportunity hoarding also encapsulates the notions of otherizing people's children, otherizing those who are perceived to not be as good as who don't warrant the kinds of things that we see our own children merit. It also leads to this not in my own backyard. And so we have these debates and these fights and conflicts in major cities and districts across the country about things that go back to 1954, about whether or not we should even be integrating our schools. I was told once in an interview by a parent that educational integration is a lost project in the American experiment, social experiment. It's about choice now. In the choice market, it's about the privatization, and in full circle, it goes back to the education as a private good. And so what we also find then is that the majority of Americans now believe in local schools, not integrated schools, but that's also racialized. If you look at the racial disaggregation of these data, according to the Pew Research Center, it's nearly 2/3 of whites who believe that, compared to more than 2/3 of Blacks and African Americans in this country who prefer diverse schools, even if they're not local. It's about 50-50 for those who are Hispanic and 50-50 for those who are Asian. Political ideology matters, of course, as well. It's more than nearly 3/4 of those who are Republican leaning who believe that it's better to have local schools versus integrated schools, whereas more Democrats are likely to believe otherwise. And we see how race is actually pulling that because of the intersections between race and political partisanship in this country. The prevalent mindsets and attitudes at the micro level that feed into the reproduction of this system of educational inequality is also spurred, I argue in my work, by a master narrative of fierce subscription to this meritocratic ideal of achievement. And we already see, as I've shown earlier from others' work, is that there's a high correlation, something as high as 0.8, if not higher, between actual test scores, which we use for intelligence and achievement, and actual socioeconomic background. So then we have to ask the question is, are we actually, we know we're not living in a meritocracy because we can see that actually the system as it is structured currently is benefiting those who are in the upper tails of the income distribution in our society. Not just the 1%, but the top 10% and the 5% as well. And we can also see how that plays out in higher education. The last thing I want to say is that research studies across the decades make the case for the value of culturally relevant and sustaining pedagogy. Meanwhile, we're in a sociocultural and political moment where politicians across the country have passed laws to actually make it illegal to teach social justice and anti-racist history, to teach anti-racism through literature, where teachers themselves are fearful for their jobs, and many of them have been fired, as well as school leaders, because we're in a moment where people are trying to go beyond the tipping point of just talking about the superficial when it comes to representation and race, to move into a deeper incorporation and understanding of how systemic and structural racism works in our society. Ironically, research studies have already shown that ethnic studies increases longer run academic engagement and attainment for students. And these are through actual experimental designs. These are studies and systems from economists and sociologists. This has always been argued by qualitative researchers and teacher education like Gloria Ladson-Billings and educational anthropologists like Django Parrish and Samia Leem, showing us how this actually plays out in the classroom to impact and to shape educational outcomes. But now it's being countervailed by the political activities and behaviors that are happening in our state houses around the country. So where do we go from here? I don't know what we know, where we're going to go from here politically, unless we actually reshape and find a way to affect change in terms of individual attitudes and voting behaviors and how leaders are actually put into these places. But the summary of my arguments is that we have to attend to the full ecology of students' lives, wedding the economic and educational policy. That cultural and political spheres need attention to read beliefs, attitudes, and mindsets driving behaviors. We have to resist this backlash against the eradication of anti-Blackness and racism in the US. And we need to increase the white tipping point for resource sharing and distribution for historically underrepresented groups. And finally, learning is a dynamic and socially constructed sphere of our lives. And we have to aim for truth. We have to aim for truth through what we teach, how we design curricula. And I hope that we don't impede the development of critical thinking of learners throughout the developmental life course in our society. So I thank you for listening to me about this, and I'll end with this quote. Historically, pandemics have forced humans to break with the past and imagine their world anew. It is a portal, a gateway between one world and the next. We can choose to walk through it, dragging the carcasses of our prejudice and hatred, our avarice, our data banks and dead ideas, our dead rivers and smoky skies behind us. Or we can walk through lightly with little luggage, ready to imagine another world. That's from the great essayist and thinker and scholar Arundhati Roy, written in the Financial Times in 2020. Thank you.
Hi, everyone. I'm so thankful to be here today. And Prudence, thank you for that. I am going to be talking about COVID-19 as well. So that quote really resonates with me. Let me go ahead and share some of my slides. Okay, so I've been at Brown. I was a postdoc, postdoc when I thought about this course. These are some pictures from my students that have taken my courses while I've been a postdoc since 2015 and then went on to be an assistant professor. And the course one of the courses I teach is called Global Dynamics of Immigrant Entrepreneurship, Trends, Patterns, and Transnationalism. And so this really is a course that was built out of my dissertation, where I really was focused on looking at ethnic enclaves and looking at how immigrants have played a role in entrepreneurship in this country and the impact of globalization and transnationalism, and to really point out that immigrants represent close to 30% of the United States entrepreneurs, but only make up 13% of the population. But we barely hear about these immigrant entrepreneurs and how they've contributed to this country, as well as race and ethnic relations and relations to class, discrimination. And there was a conference that I helped to develop and hosted back in 2016 with the Jonathan Nelson Center for Entrepreneurship, where we looked at the simultaneity of agency and equity and power and privilege when we talk about entrepreneurial endeavors. And so I just wanted to point out here some statistics. 45% of all immigrant women business owners are women. And that I particularly, because of my dual appointment in public health, I particularly look at immigrant women in the healthcare field and industry. And so there's also a podcast that I host in my class, where the students develop a podcast and really try to talk about and highlight and center the stories of immigrant entrepreneurs in Providence, as well as around the country and globally. This is one of our, well, let me just go back. This is one of our alumni. She developed a company focused on taking around care work and focusing on family caregivers. This is one of my students that just started a nonprofit that she is focused on in looking at caring for or recognizing emotionally abusive relationships and building a nonprofit in Madagascar to really center the voices of young people and developing services for that population. Other entrepreneurial endeavors that I've focused in my class are this entrepreneurial venture called Vietcetera. It's a media company that developed by Hao Tran, who was a Brown alum and has moved to Vietnam to develop this media company. And then we have Trang Dong, who also graduated from Brown, who developed a prosthetics company. It's a social venture bringing refurbished American prosthetics to the underserved disabled communities in Vietnam. And over the summer, we hosted a conference, The Entrepreneurship You Don't See, bringing visibility to new majority founders. These were some of our keynote speakers that really talked about, again, the issues related to entrepreneurship, but the intersection of race and class and gender and immigration, and the role that immigrants and minorities have played in this country as they've developed businesses. My research particularly focuses on Filipino-American women and immigrant women that we barely hear about, that are often invisible when we think about entrepreneurship. And these are some statistics that are showing that immigrant Filipino women have been developing businesses for a long time. And I have documented that they've been building businesses since at least the 1970s, particularly in healthcare and long-term care services. Here's an example of and one of the earliest Filipino immigrant women I was able to identify, who came here in 1959, worked at Cook County Hospital in Chicago, and eventually moved to California and built a long-term care healthcare business, particularly for the underserved populations. And this is just a direct quote where she talks about how she found the business, how she developed it, and particularly serviced those that came from psychiatric hospitals and did not have a place to live, and had built home care businesses to take care of them. And so when you situate that, when she's developed her businesses in the 1960s, what was happening around that time? And so if you place it in US history, it was during the time of US deinstitutionalization. Approximately when 600,000 patients were committed and living in public mental state hospitals. Due to rising negative public opinions, these facilities eventually closed, and government funding, Medicare, Medicaid, Social Security income went into the private sector, and businesses were built to take care of these populations because of the massive closures that happened around this time. And I make the argument in my upcoming book about that they became part of the de facto mental health facilities, that many of these ethnic enterprises have historically and continue to serve as part of today's de facto mental state hospital facilities, de facto state mental health facilities in California after the US deinstitutionalization era. Similar to those of nursing homes, homeless shelters, and jails, I argue that immigrant Filipino women have also built boarding care homes, assisted living facilities to cater to and care for this population. And here's just a map of 50 of the home care businesses and long-term care businesses that cater to these populations. But what was disturbing was to find, when I did talk to other executive directors of similar type of businesses or long-term care facilities, one of them stated a lot of Filipino families, quote, a lot of Filipino families were inundated and still are in this business. Very few of these gals were like me. I had an edge because of my education background, no language barriers, did things the right way. I didn't hire any family and do any of those things. I wasn't like that slumlord. Everything was very high end, beautiful homes, amenity, location, country club style. I don't take SSI residents, don't take any Medi-Cal, which is Medicaid beds, no subsidized anything. And so it kind of speaks to this like two-tiered healthcare, long-term care system that I argue in my work, where we find our immigrant businesses catering to some of taking care of or taking care of some of the least of these in our society and some of the most vulnerable populations in our society. And so the key goal of the remaining part of my presentation is to bring visibility to the role of immigrant Filipino women nurses in U.S. healthcare and long-term care systems. Also to acknowledge the complex history that brought many of them here to the U.S. and discuss some recent findings related to COVID-19. And so, and this one of the chapters in my book, which I call Hidden Healthcare, I tried to really bring a historical context and make the argument that nursing, which I had taught that Filipina immigrant entrepreneur was a nurse before she started her business. And I make this, I really point out that nursing is the largest healthcare profession in the US, with between 3.2 to 3.8 million registered nurses nationwide, and mostly comprised of women. But prior quantitative studies in public health have focused more so on the negative impacts of foreign trained nurses, including questioning the quality of their patient care, the challenges related to their language accents while speaking English, taking away labor market opportunities of US trained registered nurses, and the oversupply of nurses for export from sending countries. And so I further situate my book in looking at really referencing one of my mentors, Catherine Zazina Choi, who's a historian at UC Berkeley that wrote one of the first books around Filipino nurses in the United States that really contextualizes the historical colonial history between the US and the Philippines. And that actually, one of the major points of her work was that she draws particular attention to white American women's participation in the US colonization of the Philippines, and argues that the scant attention paid to the roles these women play will continue to erase American women's narratives and subjectivity during this time. It was in 1907 where white American women spearheaded the establishment of the first US government-supported professional nursing schools and training programs in the US. US constructed knowledges compared nursing education to missionary work and teaching and refining quote unquote little brothers and sisters. And these socially constructed power inequities between women and inferior views of Filipino women played a critical role in creating the formation of American modernity, specifically in American women's construction of themselves as civilized women, providing superior quality and creating employment disparities between these two groups. This process of marking other ethnic groups and essentializing ethnic differences and stereotypes has led to the obscurity of social, economic, and power relations that are continually gendered and racialized today. And so I also want to acknowledge that since that time, the Philippines government has also been aggressively promoting the outmigration of Filipino nurses, touting them as the new national heroes for billions they remit annually in foreign currency. But what we don't hear about, and we often don't acknowledge, is that this type of history is not discussed in public health and nursing literature. Less focus has been on prior research that has indicated that many immigrant Filipino nurses have worked on the front lines of the AIDS epidemic, SARS, and Ebola outbreaks, and ended up in hard to recruit healthcare settings, including rural and inner city hospitals, as well as my research focused on how they have built businesses taking care of some of our most vulnerable populations. And so a recent CNN article that just came out a few weeks ago really, highlighted for generations that Filipino nurses have been on the American front lines. And so there was a quote where it states, Filipino healthcare workers in the United States are at once ubiquitous and invisible. And I completely agree with that statement. Immigrants from the Philippines make up 13% of all foreign-born healthcare workers in this country, more than any more than any other country in the world, we are exporting Filipino nurses into the US. 1 out of 20 registered nurses in the US are Filipino. And nursing is the largest healthcare profession, again, but we don't hear about their sacrifices or their labor or the contributions to the healthcare system. And instead, what we do hear oftentimes in public health and nursing literature is the negative impact that immigrant labor forces have played in the healthcare system. And there's a running joke that was also stated in the CNN article where it's like, as once told at the Emmys, is that you rarely see them on medical TV shows like Grey's Anatomy and the ER, even though 1 out of 20 nurses are Filipino. And so what's devastating and what's been coming up in the last year and a half, almost 2 years, is the number of Filipino nurses that are dying on the front lines. And this is the first time in a long time that we've really heard about Filipino nurses in the media and the role they play in during the time of COVID-19. And this is a website that was started by a Filipino activist, just documenting the lived experiences and lives of the Filipino nurses that have died in this country. And so there's over about 300, I believe, on this website so far. This is some work that documents some of my research that was recently published. I recently published some of my work in Gender and Society and Gender Work and Organization. And so I'm going to just quickly go through some of my findings. When we did some analysis on the role of nurses and the role of Filipino nurses in the United States, we actually found that they were disproportionately more likely to be part of a labor union, that we found that they were more likely to be advocating and actually fighting for the rights of other nurses. So it really pushes up against this argument that the negative perspectives of immigrant labor forces, where they, in fact, and beyond just thinking about remittances, they were actually advocating for the rights of all union-based nurses in the United States. But the implications for COVID-19 is devastating. Even though Filipino nurses, we found, for the most part, in terms of pay equity, we found that they are making as much or as equal to other nurses from racial ethnic backgrounds. It does come at a huge cost when it comes to what is going on around COVID-19 and the labor inequities that still persist. We found that disproportionately compared to white US trained nurses, they were more likely to be in acute inpatient settings. That means in the emergency room, in the ICU units. They were more likely to be working in long-term care inpatient settings, such as nursing homes, so therefore being more exposed to COVID-19 than other nurses. We also found particularly they were more likely to report burnout compared to white US trained nurses, but lacked advancement opportunities. We also found they were less likely to actually leave their nursing position, and that if they did leave, a small proportion of them left just for advancement opportunities compared to whites. And they were also more likely to live in multi-generational households. So they are more likely to be exposed to COVID-19, but also bringing that back to their homes where they are more likely to care for their adult loved ones. And so we make this argument with some of my colleagues in the School of Public Health that there's a paradox occurring where altogether these findings ought to be considered as part of emerging Filipino-American health paradox. As cited earlier, Filipinos make up a large cohort of the healthcare workers in the US. A recent study found that I published with some of my colleagues at UCLA as well at Brown that Filipinos have the most health disparities compared to other Asian American subgroups, and Filipinos had a higher prevalence of fair or poor health compared to non-Hispanic whites. Rather than viewing these findings as distinct, we assert that these issues are intersectionally and fundamentally linked and have led to an alarming contradiction. So here's a paper we just published about a year ago where we found that immigrant Filipinos and Filipino Americans were more likely than other Asian immigrant groups, other Asian Americans to suffer from hypertension, heart disease, and diabetes. And then, so that was really just to point out again that even though they are more likely to be healthcare workers, they themselves are also suffering from, more likely to suffer from healthcare conditions that are not addressed, that are not centered. Those stories are not told. And so in conclusion, I just want to say that the lack of change in the current infrastructure of the US healthcare delivery speaks to the enduring legacy of imperialism. As women continue to make up the majority of the nursing workforce and have gone on to be entrepreneurial in these spaces, our findings also underscore how these systems structure inequality hierarchically in the context of nursing care in both the acute and long-term care settings, and the displacement of challenging labor conditions to immigrant women. In a time of a global pandemic, Philippine-trained nurses appear to now bear even more severe working conditions. However, less attention is focused on the impacts of the intersecting social structures and the historic precedents and its compounding impact. And with my upcoming book, Hidden Healthcare, I hope to intervene and talk about various policies, as well as the history that has brought us here, and then as well as policies that need to be changed. Thank you for your time.
Thank you very much, Jennifer and Prudence and Jose. That was really wonderful. It was remarkable how much synergy there is, even though we didn't really plan it to be so hyper synergistic. There are a couple of questions in the chat, but I want to give people some time to start populating those questions more generally by asking this. I'm really struck by the connection between in particular, Jennifer and Prudence's talks around thinking about labor in relationship to education and the workplace, that in both settings, the question of unions and labor unions and protections, worker protections, are actually quite important to what you were saying. Jennifer, yours was a little bit more obvious at the end there, but Prudence, when you're talking about curriculum and risks of losing your job for teaching anti-racist education, what are the kinds of protections? And this really gets at that higher order space of reproduction that Jose is talking about, right? The ways in which institutions reproduce race and class hierarchies. So I guess I'm wondering, what role do you see organizing, playing in the workplace, as well as, obviously those schools are a workplace, for really interrupting this kind of hierarchy that you've all spoken about? Anyone who wants to take that question, or all three of you, is fine too.
I'll just say it's a central role for a lot of the immigrant workers that I interview, that I work with, I work alongside. I think organizing, coming together, I think there's this stereotype often viewed about Asian Americans or immigrant Asians not organizing and not having a voice. We have a voice, and we've been trying to, or we have organized and we have pushed for better labor rights. It's just that, oftentimes we haven't been highlighted or centered until something like this, like COVID-19, where all of a sudden we're seeing disproportionate numbers of Filipino women die, and that's unfortunately, even though immigrant Filipino women have been organizing for decades, it's only now that we've really heard about their role in the labor unions and healthcare.
Right. I mean, Prudence, go ahead. In
the case of education, particularly for teachers and school leaders, principals, and so forth, there's a high correlation between red states and unionization. And so low correlation, actually. So the places where we are probably seeing the biggest and greatest backlash have low unionization in those areas, particularly the southern states. The areas where there is greater unionization and teacher protection, those are not necessarily the states who are passing these laws if we have this kind of political partisan divide. I do know that in the case of these acts these laws that are being passed, it's going to be a matter of time if the actual national teachers unions can go in to file lawsuits with the ACLU and others against them to push back. I do know that the National Education Association, if you look at their page and if you look at the AFT and such, they are completely opposed to the actions that have been put out by these state legislatures right now. But what can they do when so much of the action is really at the local and state level, and with decentralization and federalism in our society. And that's the big question.
Yeah, yeah. Go ahead, Jose, sure.
No, I just wanted to add that when we think about the relationship between unionization and education, there is another dimension that is often not talked, because when we talk about, you know, how to improve schools, we talk about the structures of schools, but we don't talk about how important is to unionization for the families themselves. I mean, a lot of issues of educational inequality happen because of lack of resources of families, because when we look at immigrant families, we look at families that work two jobs, that parents that cannot be in the house with their kids supporting them. And they're, you know, in educational reform, I've studied in my book about Dominicans in Province, and people were looking at me like, well, you know, just a crazy idea. But when we speak about educational reform, we need to speak about unionization, particularly unionization of the low-income workers, because that's central for them to have the resources to help their kids. And so just want to add that.
Right, yeah. Yeah, so I have a question for Prudence, and then I'm gonna move to the Q&A. So, and I guess, you know, I can see Jose piping in, I can see all of you piping in, so feel free, but I'm gonna ask Prudence about this, which is, you know, I really appreciated your moving from this notion of an achievement gap to an opportunity gap. And you've worked in this area for a while, because that distinction helps disrupt the normalized sort of class reproduction of access, right? So that the outcomes are not naturalized, right? So now, you know, we've talked about this because I'm thinking through these problems in my own work in different places. But I'm wondering, you know, what are some of the ways you can imagine that this could really remain as disruptive as it is and get more traction? In other words, you know, why are we still talking about test-based achievement gaps, you know, in the way that we are, given the escalator, the elevator, and the, you know, and the handleless staircase, right?
Yeah, right,
You know,
right.
I mean, we know what the problem is here. What are some of the ways you think we might be able to disrupt what's going on? Because it seems that the narrative is driving, you know, the problem to some degree. And so if we can interrupt it, you know, perhaps that may be part of the solution. But what have you been thinking and seeing on this?
Well, you know, there are a number of ways that I might come at this. First of all, I think K-12, there's been so much angst since the late 1980s, and then with No Child Left Behind, which really kind of concretized and solidified this just over testing, hybrid testing students. It failed. It was a royal failure in American educational policy. We actually have seen some recession from that, from the test score focus. It could get even greater with more political movement on the ground in communities, parents asking for more holistic assessment. And I want to make it clear that we do know that tests are good for diagnostic purposes to help teachers figure out where they need to go in their pedagogy. I am not an anti-tester in that way. What we're talking about is when those tests are used for high stakes and for the distribution of resources in a fundamentally unfair way. Now, let me implicate higher education at this moment. There are another number of studies. There are graphs out there showing that even when you look at the SATs and the ACTs that we use for higher ed, that they are so highly correlated with socioeconomic status. And in fact, there's one I was just looking at this morning that's startling. It is going to take systems to move and diffuse this kind of cultural sensibility about the value and what those tests mean. Right. And I think higher ed could lead in that. The University of California system has just done away over the pandemic with the use of the SAT, is reevaluating how it does admissions. I think as you diffuse at the top, it can spread throughout the system, right? It can spread throughout the system, so.
Right. Actually, there's a great question from another CSREA fellow, Gwen Purifoy, that segues really brilliantly from what I was trying to get at. So Gwen, this is a much better question that you're posing that moves us more forward. So Gwen's asking, you know, when you think of opportunity gaps and their relationship to opportunity hoarding, these are spatialized and these spaces are racialized. Schools and education systems reflect spatialized and racialized characteristics, and this shows that the state produces and reproduces, this brings in Jose's point, of spatialization of race in a particular way. Through schools, we know through is connected to housing and job discrimination. Inequalities, no doubt, tear through the bodies of our children, and so on and so forth. What would anyone on this panel think might be one initiative that a community can take to assuage the impact of this multiple layered issue on children in particular, while we work to make changes in the system, when at the same time, folks are still trying to reproduce whiteness, achieve and reproduce whiteness. So basically, what's one initiative that a community can take? And I think, there's a way for Jennifer to come in here too, around, initiatives that despatialize race in this way, to reproduce hierarchy. So it doesn't have to be education. It could be education, could be labor, could be workplace, whatever. Jose, you want to go first, and then we'll.
Well, yeah, no, that's a very important question.
It's kind of like a question if we could answer, we wouldn't be on the Zoom. Probably.
That's right.
But my answer, I don't know if I can answer this question, but my answer is tied to your previous question. I'm a great believer in community and social movement organizations. I mean, I think there are probably many initiatives that we can, and we need to think about that. And right now I'm blocked to think about concrete initiatives that can be done. But it's important to disrupt politically through community organization and social movements, this discourse that you were pointing earlier, that is all about achievement gap. Because if you look at the policy debate at the level of the city, at the level of the state, it's all about how to think schools so they can test better. It's all about technocratic solutions, about let's get better, administrators or better teachers or whatever, or let's do, charter schools. Because speaking about anything else is more complicated. Speaking about anything else is speaking about how we redistribute resources, how we get more resources and how we distribute them. And that requires really changing the political discourse. But my fear is that, I always try to tell my students, we need to think about concrete solutions while we think about broader solutions. And that's exactly what I'm not doing here, because I don't know, you got me flat-footed, but I think that the real answer is in disrupting the broader discourse and really bring questions of, providing the resources and the tools so schools and families can really deal with, the opportunity gap. Other than that will be, putting down fires, but not changing the broad picture that Prudence described.
Yes, indeed. Prudence, did you want to follow up here?
That's a hard question, because I've written a paper to say multidimensional problem spaces require multivariate and multidimensional solutions. I can't think of just one, but if you forced me to have to think of just one input into the opportunity system when it comes to actual learning for students, I'm just going to say learning because I have to choose a dimension, then the high quality teachers who are culturally sensitive and use culturally sustaining pedagogy, those matter to me. Because you may not save all of the kids, you may not reduce the group differences, but you will definitely impact some lives. And you will enrich and create a body of kids who will go on to do wonderful things. So for me, that's one of the strongest inputs we know from the research.
Right. Yeah.
But
definitely. Yes, please, Jennifer. Yeah.
When I just think about, I'm going to just kind of center around immigrant labor, right? And so I just think in terms of relation to education, to be quite honest, I really didn't understand or know about immigrant Filipino history till I went to college. I didn't learn about the history of immigrant nurses or Filipinos in the United States till college. And what's being threatened right now is like classes like ethnic studies or like in certain universities where, they can't teach, some of these histories. And that's what's, troubling, because until, when we have this historical amnesia and we don't understand our histories and we don't understand, particularly first generation and immigrant students, you're often, you can't embrace, you don't know, you're not taught to think more critically. And so that's what I think in terms of higher education, even in the elementary or even like junior high and high school, it's like, just how do we make sure that those histories are taught? How do we make sure that those aren't erased? So.
Right, yeah, for sure. We have a couple of sort of questions I'm just going to move through, because then I'm going to have a question of my own a little bit later. Okay, this one is, has there been any studies around the educational systems and their effects on Indigenous people? And, there are researchers on that, but I'm not sure anyone here is a specialist. But if anyone has something they want to offer, Terry Lynn, who posed this question.
Well, I can name some of my best buddies who are doing work in Indigenous communities, and many of them are Indigenous scholars themselves. So yes, the question, Brian Brayboy is one whom I think at Arizona State, Sandy Grande at the University of Connecticut. There are, when I was Donna Daly, she was at Utah back in the day. I read her work a lot when she wrote about the conflict, the cultural conflict between American education and the home and Indigenous cultures. There are a lot of people who have done it. I think maybe where the question comes from is why we don't see Indigenous folks show up in these large data sets. And a lot of it has to do with measurement of identity and the cell sizes, the population size, because there's been a lot of merging of identities across categories. So I can appreciate the question, but a lot of the actual theoretical and conceptual frameworks that are applicable to people who have been afflicted, history of settler colonialism, African enslavement, forced conquest and incorporation, all of those communities have some similarities in terms of the challenges that they face in American public education.
Right, right. Let me ask a broader question, not just about education, because I think one of the threads that runs through this whole conversation is about, the structures of inequality and then their relationship to communities, particularly institutions in communities that are, either serving or emanating from marginalized, vulnerable communities. But let's take the COVID context a little bit more focused in a central way, because what we've seen is one of the highest levels of economic inequality in history over the past 10 years or so, and it's getting worse. And COVID looks like the effects will be even greater. We're also seeing a tremendous amount of labor unrest around the same kinds of communities, including poor whites, who are protesting that kind of exploitation through just refusing. I mean, everyone's saying the economy's not going to recover if people don't go back to work. And, the question of like, what's everybody doing and what's their point and what are they protesting? I think this is really important to connect, teacher strikes, community organizing to stop schools from closing, to force resources to be reallocated, which is another form of addressing this general inequality. The same thing with, essential workers, right? Nurses these are essential institutions, right, that redress inequality. So I'm just wondering if any of you want to sort of tackle what do you think COVID will do here? How severe will it be regarding these questions of inequality in the various institutions and professions we're talking about, and so on? Jose, you go ahead.
Well, okay. I mean, one thing I want to say that COVID has done, but we are not really internalizing, is this idea of essential workers. If you think about essential workers, who they are, I mean, in part are, very obvious doctors, nurses, but also bus drivers, teachers, supermarket workers,
Yep.
So a lot of the low-income workers, the workers that earn very little, that really are, whose work are not valued. And it is many of those that are right now saying, well, no, I mean, we don't go back to work under these conditions. I mean, how much people can held out of the labor market, it's a question. Because, I read the New York Times, and the New York Times tells me that people are flushed in cash, and I say, like, low-income workers flushing cash is more like, in a sense, these very low-paid jobs don't really, you have to travel to them, you have to get, they care. At the end, you get very little out of them. So I remember at the beginning of the COVID pandemic, I remember reading some, global intellectuals saying, this is the end of capitalism, blah, 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 blah. Obviously, that was, it was evidently wrong then, and it was evidently wrong now. What COVID has done is exacerbated the tensions in capitalism, and then showcase some countries that have the tools to deal with those tensions. But I think that this gives us an opportunity to really change the discourse about what we value, about what we consider decent work, important work. But it's a work that we need to do. I go back to the question of organizing and changing the discourse. If there is not done, I mean, what COVID is going to do is really, exacerbate the existing inequalities, which is what we saw. Communities of color, poor communities suffering more death and more sickness than, more middle class and more established communities. Class matters. So, I mean, we as critical scholars, what I think we need to do is to point out to all these things that COVID has showed us and has brought to the surface, and really, point to the different intersections of race and class, and how class matters here, and how, when it comes to essential work, all the work that is not valued suddenly is essential. Yeah. But that depends on us doing the work, not only us, organizers, the political system, but we as part of all that, of constructing discourse in society, need to be very clear on that. So otherwise, COVID is just going to make things worse than they are, which it did already.
Right.
Yeah, when I think about this question too, I also think about what are some of the two things that come to mind is one, as people have been at home and away from work, they've also reassessed what's meaningful to them and what's valuable. And some folks have actually now have a penetrative gaze. I'm not going to be exploited. I saw last night on social media a sign for workers where they were paying $2.13 an hour for a restaurant server plus tips. In 1986, when I got my first high school job, I was being paid $2.01 an hour. Can you tell me it's only gone up 12 cents in nearly 30 years? That's crazy. Mm-hmm. And so I think people are not going to risk their lives. It's certainly a cost-benefit calculus, but then there are also some implications for education and where we are actually channeling folks. If you look in some sectors that are also essential, I was just talking to contractors and look at the supply chain. We have so devalorized jobs like those in the skilled trades, that there is a fear that we're not going to have enough people to actually have the skills to build homes in a few years, right? Because of the devaluation of it in this knowledge economy. And so that does have implications for how we may even think about the structure of education and training in terms of the long-term well-being of the country. Green economy. Who's going to be taking care of building the windmills we need and the solar panels and all of those things? So there are some implications about what we're valuing as work in addition to how much we're paying and the conditions, other conditions.
Absolutely.
Can
Yeah.
I add to that as well? So the other research I do is on domestic care workers, and I think they are some of the lowest paid. They're in the totem pole of care work. They are definitely undervalued, and now they're all of a sudden essential, you know.
Yeah.
And so when talking to, when they're essential, but are we paying them like they're essential? And so in talking to some of the owners, like the immigrant Filipino women that I've interviewed, that they've had to rethink, like, how, you know, in terms of minimum wage, like if you want workers, you're going to have to pay more and value them. And I think we're in a moment where we're seeing that more. I did read some articles where the minimum wage is increasing, or that jobs that usually would pay, I guess, $11 to $12 now paying $15 to $17 to get people just to apply. So there is some disruption going on that COVID-19 has created in terms of really exposing who the essential workers are, bringing more visibility to them. But we're also in a moment we have to make sure that we don't exploit them, that we do pay them a living wage. And I think we're seeing more of that. I do believe that that's happening more.
Yeah. I mean, I think this, you know, Jose's point about taking this notion of essential and sort of treating it as a dramatic narrative shift, and at the same time as an organizing principle for, you know, not just union work, but also industry in general, and obviously for wages, but also for a concept around, you know, what do we value? Who are we? And, you know, are we willing to really acknowledge that without all of these essential categories of work, we would not be sitting here today, right?
That's right.
Literally. And that's you know, all the delivery, you know, that's the Amazon delivery, that's the groceries workers, as you pointed out, it's teachers, you know, nurses. It's really about as profound as that. We literally wouldn't be here. Okay, we got time for a couple more questions. This is a dear colleague, a Brown colleague, Lena Frusetti, who is asking the following. You all address the problems of facing the students in their educational journey. But once they break the sociocultural blocks and inequalities that might define their progress, what exactly is the cause for the higher dropout rates once they achieve a place in higher education, colleges or universities? What else do we need to do, I guess, in the higher educational context to mentor and support students who still meet the same experiences now in college? And so I can see a few of you answering that from different perspectives. Prudence, did you want to go first there?
Wow, that's who meet the same, I want to make sure I understand the question, who meet the same kind of cultural ethos of education?
What the ones, basically there's still people who overcome all these hurdles, get into higher education, and then find themselves unable to stay or drop out. And so the question is, what is the cause of this higher dropout rate? And what else do we need to do to mentor and support students who still basically have the same experiences, the same kinds of, I'm assuming Lena means, you know, discriminatory or maybe curricular irrelevance, you know, which Jennifer was talking about, or lack of mentorship, lack of investment. In other words, they still have a staircase with graffiti on it, is the point.
That's
even
right.
though they're
That's
in
right.
higher
I see what you're
education,
saying.
right?
Yeah.
And so, like, what can we do?
So it's important also to think about the stratification of higher education. You know, the selective colleges and universities, their time to graduation and graduation rates by groups are still significantly higher than some of the comprehensive colleges and universities who are not as selective. But then still within that band of selective colleges and universities, you see racial disparities and class disparities. Students can still, first-gen students, and many of them who come from low-income backgrounds, can be economically vulnerable. Those students who are working full-time jobs and then also trying to carry a really rigorous load, or have it in the university is not doing anything. We're so happy to have that diversity within, but diversity doesn't mean that we're fully scaffolding students. The other thing is the structural racism. We're not inoculated from it by going into college, right? It is going to manifest in higher education as long as you have those of us who've grown up in a racist system teaching inside of those universities, right? And we bring all that baggage with us. And so the same kind of things that we expect and demand of K-12 teachers, we need to demand also of higher education professionals and professors as well. There's a lot of pushback on that, of course. And so DEIJ has just become pretty diluted in some sorts. So I think we still see some of the same. That's why I say we can't just think about the material. We have to think about the material and the sociocultural and political that is plays out in education and how to disrupt that, because they're very similar. And I agree with that in K-12.
Yeah.
And it starts with the professors, a lot of them, and also how we understand students' differences as they come in these spaces.
Yeah, I mean, let me just comment on that, and then I want to hear from the other two of you. But, you know, one of the things that's so interesting is that we're talking about how outrageous it is that, you know, people are banning, you know, ethnic studies, right? When ethnic, you know, in K through 12, when you could barely get ethnic studies on college campuses, right? And if it weren't for student protest, there wouldn't be none of it.
That's
then,
right.
Of course, when you try to diversify the curriculum and say, well, you know, we really have to teach different things. No, we can't tell people what to teach. We can't tell a discipline what to do. Like, well, how did that happen, right?
Yeah.
So in any, as just a, you know, a peanut gallery comment, but
that's appreciate it. It's real.
Yeah. I mean, it's like a little bit of denial. Jennifer or Jose, either of you want to comment on Lena's question?
Well, I can, you know, there are, I think, two issues that both CEO and Prudence mentioned. One is the economic issue, the cost of higher education and, you know, the burden of that cost. And again, that goes to, you know, political questions of financing. I mean, you know, Brown is going to be expensive, but to have great public colleges that are accessible, and also within Brown, I mean, and it has been done to a large extent, you know, making it more affordable for people of low income. But then is, you know, the culture of the institutions, which I think is what Prudence were alluding to, and what you were alluding to. I mean, you know, we know how much it took to get Africana studies, you know, institutionalized the program, and you know, as long as the higher education look at those programs as lesser programs or not real, you know, serious areas of studies, and as long as it doesn't create a culture in which people can see themselves invested and reflected and appreciated, it's going to keep, you know, sending people away. You know, we know that, and so it's a struggle on those two areas, you know, how to make college less burdensome. And, you know, those who have more years than me may remember a time in which public education was free or very cheap. And the question of, you know, making these institutions having a culture that is really, you know, talks, you know, interpolates people, a diverse body of population, and that is a struggle. I mean, as you were saying, and I always tell to my students, you know, to the extent that there is something good here is a result of student activism. I mean, and you know, I think that we have had a very good administration in the last years that have been receptive to these issues, but ultimately the push comes from below, and it only comes from below.
Right. Yeah,
I agree with what everyone has said. I mean, I think spaces like CSRA are so important. I remember just being a postdoc and coming to CSRA's like events. Like it was like one of the first things I did. Another space focused on undocumented immigrant students. Like that was another space that, you know, I found myself gravitating to as a new professor, just, you know, being around like-minded folks. And and being a person of color at the Nelson Center for Entrepreneurship, I do see that representation matters, that students of color, minorities, and immigrants tend to, you know, reach out to me, particularly if they're first gen and they're interested in learning about entrepreneurship, but doesn't quite understand or who to talk with. And so there is this, I would say, burden almost amongst, you know, minority professors at times in terms of the service work, in terms of focusing. And I love working with my students. I love, you know, hosting office hours, but, you know, the service work around, you know, being there for those for students that I was once that student myself, you know, it becomes difficult to manage also the academic side and the research as well.
Right. Yeah. I mean, I think what you're all getting at, and Lena's question was, I think, encouraging us to think about, was when we think about this reproduction of race class hierarchy, which we've all been addressing, and the three of you have given us so much to think about. One of the things it does, it doesn't just reproduce the bottom in visible ways, it reproduces the top in invisible ways. And so when we're in classrooms, right, kids are uncomfortable, they might want to drop out. Why? Not because they don't want to work hard, not because, not only that they can't find mentors who look like them, there's an implicit exclusionary framework to the disciplines that they are in, right? It's not just, I need someone who looks like me, it's called, I'm countering, right, the reproduction of hierarchy and the invisible nature of that reproduction. And I think that's just as important as the hyper visibility of those who are left behind, if you're paying attention, right? It's really about the invisible structures at the same time. Well, I mean, I could talk to you three, just all I need is a glass of wine, and we could be at this for quite a while. So, and I would certainly have a wonderful time. So I just want to thank the three of you for inaugurating this year's series and being so fantastic. And to thank everyone who came and joined us and participated and stayed on all the way to the end. And of course, to all the amazing tech staff and the incredible CSREA staff and the Provost and the Provost's office for all they do to make this happen. And so we'll see you all. If you must be on our mailing list, we'll let you know when the next event is soon. And we look forward to seeing everyone at the next Race And.